Diabetes is a condition that can result in serious complications, and it is important to closely monitor your blood sugar levels. Blood sugar testing is done at clinics to measure levels of HbA1c, or the sugars attached to protein in red blood cells. It reflects your average blood sugar level over 3 months. If you have type 2 diabetes, you should consider performing self-monitoring as well, in addition to clinic-based tests. Self-monitoring is done at home using a blood glucose meter or glucometer and measures the level of sugar in your blood at that very moment. Such self-monitoring is important if you have increased risk of low blood sugar or hypoglycemia, are pregnant with pre-existing diabetes, or gestational diabetes mellitus, are experiencing acute illness, have difficulties achieving blood sugar goals, or are fasting for religious reasons. Here is a recap of when self-monitoring is particularly important. These are the steps to perform self-monitoring. Wash your hands with soap and water and dry with clean tissue paper. Insert the test strip. Use the lancet device to prick your finger and squeeze gently to get a drop of blood. Touch the end of the test strip to the drop of blood. Cover the puncture site with a clean tissue and apply pressure. Wait for your blood glucose level to show on the glucometer screen. Testing of blood sugar levels should be carried out before a meal and 2 hours after the meal. A simple table can be used to note down the readings. Compare these numbers with the targets set by you and your doctor to determine if you are at risk of high or low sugar levels. Other instances where blood sugar testing should be carried out include before and after exercise, when you are sick and not eating well, and when you experience symptoms of low blood sugar or hypoglycemia. Beyond self-monitoring, it is important to go for regular checkups to detect and prevent complications. Every 3 to 6 months, you should receive testing and assessment of your weight and height, blood pressure, HbA1c or blood sugar levels, as well as your level of stress and emotional well-being. Once a year, you should receive testing and assessment of your cholesterol or lipid profile, kidney function, eyes, and feet. You may be required to undergo other tests or undergo testing more frequently. This will depend on your condition and the advice of your doctor. With a combination of regular self-monitoring and consultations with your doctor, you can manage your diabetes and continue leading a full, fulfilling life.